Welcome back. Breast cancer mortality has gone down in the past few decades because of earlier detection, diagnosis, and prevention efforts. However, individuals with the BRCA gene have higher chances of breast cancer. What does it mean for women who may be considering genetic testing to identify their breast cancer risk? What are some of the prevention methods? Joining us to tell us more is Dr. Roshni Rao, Chief of Breast Surgery at Columbia University Irving Medical Center. Thank you so much for joining us today.
Thank you.
We both have on our pink,
Yes,
right?
absolutely. It looks good on us.
It does, it does. You know, I just want to, first of all, just say this is amazing what you all are doing, with breast cancer and just bringing down the numbers of women who are affected. We just want to talk about the early diagnosis and the prevention. How do we make sure that women are encouraging them to go after these tests and to make sure that they're having it done annually?
Yeah, so there's a lot of controversy about mammography in particular. When should we start getting mammograms? What age should we start? How often should you get them? And I think those are all things that need to be worked out. I think one thing that is very important to know, though, is that there is no controversy when we look at the very well done studies that mammograms save lives. So that is key to remember. What age you should start, how often you should get it. We can talk to you about that, actually looking at your individual risk, and there are ways that we can do that. We can put in your information, things like what age did you start your periods, how many children have you had, what is your weight, have you taken hormone replacement. We can put all those things into specific what we call nomograms and risk calculations and figure those out and help personalize how often you should get your mammograms. But mammograms do save lives, and it's important to get them and talk to your doctor about how often and when you should start.
So tell me more about the gene testing, about BRCA1, BRCA2. What is the difference between the both?
Yeah, so there are three things, if I'd appreciate the opportunity to share with your viewers, three things about genetic testing that are important to know, particularly about BRCA1 and 2. So number one, the genes are what we call autosomal dominant. So you can get it from your mother or father. You can pass it along equally to a son or daughter. Sometimes I get patients who come in and they say, you know what, there was nothing on my mother's line. Why do I have this? Keep in mind that your father's line is just as important. So let's say you have a father who had two sisters with breast cancer and he himself had prostate cancer. That's important, and it could impact what your risk is. Number two, when we look at these genes, they predispose to several different types of cancer. So prostate cancer, ovarian cancer, pancreatic cancer, and breast cancer are all carried on these genes. So just because you don't have breast cancer doesn't mean you don't carry these genes if you have some of these other abnormalities. The third thing is that people who carry these genes, particularly BRCA1 and 2, may have up to a 50% chance of getting breast cancer. Wow. And if you have that information, you're going to be much more empowered to be able to manage your risk versus being blindsided by something that you didn't know.
So if someone does have one of these genes, how do you go about managing the risk of getting breast cancer?
Yeah, so that's a great question. We really try and individualize that based on where that person is during their lifespan, if you will. If you get diagnosed, let's say at the age of 25, and you're still thinking you may want children and still want to preserve your fertility, then we are able to tailor what we offer to you based on where you are. It may involve things like just watching you closely for a few years. It may involve, for some women, having to have both breasts removed. We talk about Angelina Jolie a lot because she had one of these genes, and she chose to really take some pretty aggressive measures to try and reduce her risk. But you don't have to go that route if you don't want to. There are other alternatives that we can do to just manage your risk appropriately.
Now, is this stressful? Because honestly, like if I find that I have the gene, do I want to have that fear of being tested so often? Because I know there's some people who don't want to go to the doctor, who say, you know what, I'll deal with it when it comes. But tell us why, and I know you've said this, but tell us again why you should not wait.
Yeah, and I get that a lot. I have a fair number of patients who are like, oh, I just don't want to know. It'll make me sad, and my family will be like, what did you do? And you have to kind of think of it in another way, and that if you have that information, and we all know that information is power. Mm-hmm. So this is the same line, right? If you have that information, you can know what you need to do to not be in a position where you're going to need chemotherapy and radiation and all sorts of other aggressive treatments. You can manage your risk appropriately. Again, going back to what you had said originally, we are much better at curing breast cancer if we can capture it early. And being in our protocols where we just keep a close eye on you, and we're not so bad to hang out. Some of my patients who have these genes, I see them every 6 months. We meet, we talk about what's going on, and they go on. So I think it's just a much better position to be in.
Now, talk about the technology. It has been advanced throughout the years. Now you're able to have 3D imaging, right?
Right.
And be able to get a closer look at the breast to really catch if there's anything to catch.
Yes, so we do offer what we call 3D mammography. The medical term for it is tomography. So the way to think about it is that if you have a camera and you just take 2 shots of something, you have this table and you take a shot from here and you take a shot from here, and that's what you have to figure out, is this table have 2 legs or 3 legs or 4 legs or whatever it is. And that gives you some information, but it's not as good as if you had a video where you can shoot this table all the way through. So that's what 3D mammography does, is it allows us to take multiple cuts through the breast, 2-millimeter cuts, to allow us to really look at all that breast tissue. And there's several studies that show that in women who have dense breast tissue in particular, and your mammogram report will tell you if you have dense breast tissue or not, if you have dense breast tissue, we will identify 10% more breast cancers.
Excellent. For someone who may be watching right now, just tell me how they can make sure that they're getting this test done.
Yeah, so you can ask for it. That's the biggest thing. Say, do I have dense breast tissue, first of all? And number 2, would you recommend a 3D mammogram for me? And I know that picks up more breast cancers, and how do I get that if you think I need it?
Excellent. Thank you so much, Dr. Roshni. Very valuable information. Thank you so
Veronica.
much.
Appreciate it.
To schedule an appointment or to learn more about your health, you can visit their website at columbiasurgery.org, breast, or call 212-305-9676. Don't go anywhere. More open after this.